Right. So you also have a slight maxillary hypoplasia, like a very minimal one on clinical examination.
Yeah.
Show me this. Yeah, and you have underbite.
Yeah.
Okay, open your mouth. Bite, please. Okay, relax. So in your case, we don't have to touch the lower jaw most likely.
Okay.
We will just have to bring the upper jaw forwards and downwards. That should be enough. This is just a mild underbite, looks like. Because for your height, this is okay, this is good.
Why? Because he said that he really...
Then don't do it. It's something, underbite's better to be corrected because underbite is indicative of a growth issue with the upper jaw. So it could be because of lower jaw, could be because of upper jaw, could be because of both. But looks like it's more of the upper jaw in your case. So we can take a scan and find that out. But on clinical examination, it's probably going to be just upper jaw surgery for you.
Okay.
So upper jaw is going to be brought forwards and a little bit downwards. Also, if you see your grooves are there, it's just a little bit sunken. So all of that is going to just look better.
Right.
And again, you might need braces. Might. After surgery, so that to make sure you have some good occlusion and all that.
But you feel he should go for surgery?
Yeah. So he has an issue. Underbites. So you didn't. Now, what we did for you is a cosmetic surgery.
Understood.
Okay. This is a more important surgery than what we went for you. The reason is because this is also affecting breathing, sleeping. The airway is less, biting, chewing, everything. Is it a mandate? No. Is it better? Yes. Is it a cosmetic surgery? No. Does it have a cosmetic improvement? Yes. So it's that kind of a surgery. It's not like in your case, everything would be like yes. Is it cosmetic? Yes. Is it, but.
For him, can you put some aligners or some...
You can't correct it without surgery. Again, just let it be like this otherwise. Because if you try to correct it without surgery, that's going to mess up the teeth, the relationship, everything. He has not only a teeth issue, he also has a little bit of a... So you just let him be the way he is. He's fine. Otherwise, get the full thing done. Not try to do something without surgery because I don't think that's going to solve the problem that well. Because underbite is... It's not end on. It's a little bit. They'll come up a little bit. The grooving will go down because the face will have a nice, more forward-looking thing. So, hello. Yeah, given local. Yeah. Okay.
This would be the upper jaw.
Most likely. If I feel otherwise, when I see the scan, I can let you know.
So get it done now. Is it possible to get it
You
done?
can get it done, but again, I have a surgery now, so I'll take a couple of hours before I come down. That's why I said, ask them to ask why the scan is not there.
No, the doctor was there.
I'm in between surgeries now.
Yeah.
They just called me to say that they're going to start the next surgery. So if I go on top, it's going to be 2 hours. So
What
then
would be for current, what you were saying, what about current?
they'll do it. They just clean up. They put some braces, like a clips, and they'll put some elastics so he can bite better.
For how long that will be?
Few weeks.
Few weeks.
Before when or you can just take them off when he goes to the US or something. Or even before from Pune.
Can you do it from any dentist?
Any dentist you can do it.
Okay.
It's a straightforward thing for him.
So what is that procedure called?
Coronoplasty
Okay.
and also braces. We're actually putting a braces for him. But the braces we'll put elastics, not wires.
Okay.
Just to guide. The doctor, she'll have a look tomorrow.
Okay.
She'll do that during the daytime.
That will be done in one day only.
45 minutes.
Oh, okay.
1 hour. Clean up inside. That I don't know. The other doctor will have to have a look. That's a strange complaint. I don't think it's because of surgeries, but let them have a look.
Yeah.
Whatever that is. After that you're saying, right? So let them have a look.
I was thinking could I use aligners for my bottom teeth or should I just leave them as they are?
Aligners to get the teeth in proper shape.
Yeah, just because like I think I have like overcrowdedness, like
Yeah.
so I just want it to be like just straight.
Yeah. So what happens is when you make the teeth straight, then they'll have to remove some tooth
Oh,
and then make it straight.
oh, so like regular liners wouldn't work.
I don't think it'll work. And how does it help you? So how does the aligners help the? Can only make the teeth like
Straight, yeah.
straight.
Yeah.
But imagine if it's crowded like this. Okay.
It'll still be crowded, yeah.
No. This is the arch. It's crowded now. When you make it straight, it'll come out more, right?
Yeah.
Yeah.
Oh, so
Understood.
it'll make it even worse.
It will make your condition worse. Or to counter that, they pull out the tooth. It's just area. You have a
Current was pulled down.
yeah. Otherwise, they remove the teeth and then put the aligners.
Okay.
And that's not a good thing if you want to do surgery later on, because they're trying to do a procedure to avoid surgery.
Avoid the surgery, right.
But do you think the surgery is avoidable?
Surgery is avoidable, but better not to do anything.
Okay.
Acha.
You do some braces and then in the future after 5 years, because they're going to pull the teeth in,
Yeah.
so your space inside is going to reduce, right?
It's worse.
Yeah, correct. And then you want to do surgery, then they make it difficult.
That's what he's saying, that you have to go for a surgery in order to, you said you can choose. Listen, what he's saying, that okay, you choose now or later anytime, but don't do anything because your face is normal.
Yeah.
It's not
Yeah.
kind of what Karan is.
That was like a much more serious
Serious,
case.
Yeah.
So if we would call that a classical, that definitely needs surgery.
Surgery.
Yours, I would think it needs, but depends on you because you're not having any issues with this much of the thing. So that's up to
Yeah.
you.
Okay.
But don't do anything in between.
Yeah.
That's what I'm trying to say.
Yes.
Because doing in between sometimes worsens your condition and then will push you for a surgery, and then the surgery becomes more difficult because it's already been done.
Yes.
Alright, okay.
Okay.
That's the only
Yeah,
thing.
that makes sense.
Oh.
Oh, the dimple. Okay.
They are all laughing from the day I was not planned according. The way you said you that's it. So they were, make yourself more, younger.
No, you look very nice, don't worry. But the
Yeah.
dimple thing is what I'm. See, genioplasty and this procedure adds a lot of improvement to the face. In fact, if we do a surgery for him, it won't make that much improvement as what is made for you.
Yeah.
Oh, is it?
Yes.
No. He'll have better bite. He might be able to breathe better in the long run when he's 40 or 50. If otherwise he develops snoring, he may not. Those kind of benefits he'll have.
Rohan, listen to everything.
Oh, yeah, I am.
But the aesthetic concern part will be slightly better, not like you. Your thing will be off because the chin does that kind of a thing. Always is nice to have a strong chin. And another thing also, you must be careful when you go, if you go elsewhere and consult for people, they generally think that the problems with the lower jaw,
Yeah.
they take it in.
Yeah.
No,
No, we are not sure.
no, just for him to understand, he's just 20 and I get to see many patients from across the world because they think the problems with the lower jaw and then they take it in. But it doesn't, it's counterproductive because it reduces your airway.
No, that's a live example. It has come out soon.
Yeah. It'll look much better, huh? This is just 10 days.
Yeah.
He's gonna look way more handsome than
So like a
that.
human finally.
That's being mean now.
See him once the swelling and all is gone.
Yeah. You have to give him 2-3 months, a little longer.
And now
But you're not gonna have that much of a difference.
Yeah.
Not even as much as your dad, but there will be some difference. But if you're not someone who is keen on getting it done, just postpone it till such a time you think
Yeah.
you need to get it done.
I mean, if that's
Because it's a major surgery.
Yeah.
And you'll realize, so your recovery period also, it's going to be between those two. So you watch them both heal up and yours is going to be between.
Okay.
Yeah, it's not going to be as easy as your dad and not as difficult as him.
Okay.
It's going to be in between, generally speaking. So that gives you an idea about healing, gives you an idea about what kind of improvements you can expect, what kind of complaints they go through, and then
no, when he says because now he has to go for a very high level of course,
6 weeks.
he can start with the full eating and all those things.
Yeah, so we can start. 6 weeks, he should be fine. He'll know when he's feeling fit.
Yeah.
You slowly start on, you have your protein diet and blah blah.
You start it.
Then it's fine. You start, see, you shouldn't fall down. Or then, you know, many plates and screws are there inside. Or rackets hitting it.
Come back again.
No, it's a big thing. It's a big problem. So that is something you have to be careful, you know. Normal circumstances, nothing would happen if you fall, but 1.5 months after surgery, it
Yes,
wouldn't have
it
healed
will.
up fully. For it to have healed to pre-surgery status, I would think will take about 2.5, 3 months.
3 months.
3 months.
After that, I mean, even if you fall, it would be the same result as
Like
what would
a
have
normal-
happened had you not had the surgery types.
That's what it is.
So mine will be like roughly 2 months of complete recovery time. If I get the thing on
Yeah.
my job.
Yeah, safer because you're playing tennis.
Yeah.
If you're an IT, 5 days, 1 week. Yeah, that's what it is. They just sit and come work, right? They can
Yeah.
work. You're playing tennis, so it's
Both
like,
are at that
yeah, you
stage
need,
where they have to really work very hard.
yeah, so you need to get the time out.
So doctor, for tomorrow appointment should we take now or not directly?
Come directly at 10 o'clock.
11
For
o'clock.
me, how will you do?
Yeah, that's a problem for you. I need to schedule it. So for you, when are you all going back?
No, that was actually we were waiting for you. Today we wanted to look at back ticket,
Okay.
but we said once we meet you and then we decide.
So only thing is your dimple now. That can be done later on also, right? You want me to do it tomorrow?
Let's finish it up.
But what about your medicines? Have you started taking it?
Taking.
Then again it can-
just normal anesthesia.
Surgery है फिर भी ना हो जाएगा. But you started taking medicines but back.
Yeah.
Yeah.
Okay, we'll do one thing. Anyway, you don't have to fast. You don't have to do nothing. Just come over tomorrow. I think around 10 or 11 I'll let you know if possible. We'll do it off tomorrow. If not, day after पक्का.
ठीक.
कल maximum I'll do. Otherwise, day after.
कल हाँ कल हो जाए तो अच्छा हम लोग रात में we want to go back to Pune.
अच्छा. Then I'll try tomorrow. कल के बाद इनको ट्रीटमेंट नहीं रहेगा. We'll finish off with him.
हाँ, his will be done, mine will be done. रात की 2:30 there is a flight direct.
Correct.
I don't like the Jogi, that only goes and comes back. Pune to Trivandrum.
Correct. Indigo. Midnight
Yeah.
flight.
1:30, reaches by
Huh?
3.
You already know it, huh?
I already know this Pune flight thing.
Reaches by 3, starts at 4.
Yesterday also somebody went by that flight. It's good actually, you know.
Yeah, actually.
When I'm going to the airport, I always look for flights like this because you know what? You save 1 hour on the traffic,
Yeah.
and then when it's night time, I tend to sleep off in the car
Yeah,
also.
exactly.
Drivers going, I
Sleep in the
mean,
car and the flight.
light nahi hai, फिर you reach there also less crowd.
Yeah.
Airport is also free.
Yeah.
Check-in is also faster.
Yes.
Headache is less. Fast on the flight. There also is fast. There is a.
Yeah, early morning you'll reach, no traffic.
So it's a big thing in the US, right? These flights that fly in the middle of the night, what are they called? In the US?
Middle of the night.
Yeah, they have flights, it's called some name for that.
I don't know. Usually they have flights like throughout the entire day.
No,
Yeah.
what they called as.
But there's a special, some name for these flights that are midnights, and there are many like this. Even in the US, many people take because there it's less expensive also.
Yeah,
Yeah,
that's
they-
true. That's true.
He always takes the night.
Yeah.
I think it's like after 10 p.m. and before 5 a.m.
Some-
yeah. Then it's
No,
like.
so what is doctor's trying to
Some
say?
special
There is a
name.
special
I don't
I
know.
forget the name. I remember somebody telling me a name once. So what happened was I was supposed to take a flight from where I think somewhere to Chicago to Miami or something. I missed the flight
Yeah.
in the morning, and so then they put me on a flight like that.
Yeah.
Yeah. So we'll see you tomorrow then.
Oh, red flag. Red eye.
Yeah. What's that red eye flight? What is that exactly?
Red
What?
eye.
Red eye, midnight flight.
Yeah.
Okay, red eye. See, I told you that was the name. And these guys were like red eye flight. I'm like, what?
What? I was thinking, how can I get red eye?
No, they said this is because I was like red eye.
I
I was
was
like, I literally didn't understand for a long time. Then they said it was a red eye. Okay, red eye flight is a midnight flight. They have a name like that in the US.
Yeah.
I know this. Because your eye get dry na, from sleeping.
Ah.
When you wake up, your eyes are
Red eyes. Good name.
It was actually today. I was thinking.
It's a good name. Yeah. Shall I won't forget it next time.
Alright.
Doctor, thank you so much.
Pleasure. Yep.
Oh, you also tell us.